definitely deserves.
I just realized I didn't have the record button on. So do you want to just repeat that slide, please? Or go back one? I'm sorry.
Oh, yeah. This is the first slide, so I'll just repeat this one. So what I was saying is, why are we talking about Navicular today? Well, a study from, 2000, whatever, 10 years ago is that 65% of lame non-racing sport horses were diagnosed with navicular. So I mentioned that if you think about all the structures that can go wrong in a horse, hips, hocks, stifles, back, neck, carpus, fetlock, pastern, to have 65% of lamenesses attributed to just the back half of the foot is mind-blowing to me. So I think it definitely deserves a discussion and deserves some attention as to how we can address this and how we can prevent this, but also what we can do if this is a diagnosis that your horse has received. All right, so first, what is navicular? I'm sure if you're on this webinar, you've heard of navicular, you probably are pretty familiar with what it is, but many of you have most likely heard the commonly used terms navicular disease versus navicular syndrome. So these are often used interchangeably, but historically they have been used to describe different scenarios. So navicular disease is said to describe cases where a lame horse has radiographic changes to the navicular bone, and syndrome is used to describe a lame horse where the horse shows heel pain, but you don't see any changes on the radiographs. So again, historically, navicular has been thought of as a degenerative bone disease where the navicular bone is demineralizing over time, and the syndrome diagnosis, it was thought as, well, the bone changes aren't shown on radiographs yet, but that pain is starting. So pretty soon the syndrome is going to develop into navicular disease, and you're going to see demineralization of the bone over time as we take radiographs. Now, if you know me at all, you probably know that I don't believe that navicular is degenerative, that I kind of disagree with these ideas. And I personally don't think that navicular is a disease of osteoclast overworking. I don't think that it's degenerative, but I don't think that it's also, I don't think it's genetic. Some people think it's genetic. I don't think that it's just once they have it, they're always going to get worse and worse until they're unusable or have to be retired or have to be put down. So we can get a little bit into that later, but I want to tell you what historically this has been defined as. So the truth is, the more we learn about navicular pain, the more we realize that navicular is a catch-all term for pain in the back half of the foot. So vets and anatomists have found just how many structures can be affected with this issue. There are bones, obviously, in the hoof. There are tendons, ligaments, cartilages, and the name has, since we've learned all these different structures, the name has actually swapped out a few times. So navicular has been called just caudal hoof pain. Some vets will just say heel pain. There's a new term that's often been thrown around lately called podotrochular syndrome. The truth is, all of these are saying basically the same thing, that the horse has pain in the back half of the foot. So we're going to talk a little bit about how you can kind of distinguish where that pain might be coming from. But to label it as just a navicular bone issue is a little bit of a misnomer. All right, so symptoms of navicular pain. I'm sure that if you have a navicular horse, you've seen some of these things. Horses that have been diagnosed with navicular or have heel pain might have a shortened stride, and obviously a shortened stride can equal toe first landing. So you can see in this picture here, this horse is, when it hits, that hoof hits the ground, the toe is hitting the ground first. In an ideal scenario, that carpus, that knee, will be fully extended, and that horse will be landing subtly heel first and using that back half of the foot to absorb shock from the ground. So horses that have heel pain are going to avoid that and have toe first landings. Some horses might have a shuffling gait. You might notice that your horse has been tripping or struggling on sharp turns. Some horses with heel pain might point their affected foot. So the foot that has the navicular diagnosis or the worst navicular diagnosis might actually rest that foot out in front of the other. The horse might have sensitivity to hoof testers. If you place the hoof testers over the middle of the frog or around the bar section, they might have reaction there. And if the horse has a soft tissue injury involving the soft tissue around the navicular bone, you might notice that they're moving worse on soft ground or in deep footing. And they might actually seem more comfortable on hard ground, like a barn aisle or a driveway. All right, so how is navicular diagnosed? I'm sure that, you know, if you've gotten a diagnosis, you've gone through some of this. But typically an owner will call out a veterinarian due to a lameness with their horse, and the vet will perform a lameness evaluation. So in a vet might watch the horse walk and trot around in a straight line and in a circle. They'll find out which limb seems to be the most affected. And typically what they'll do is they'll start with something called a palmar digital nerve block. And what that is when the vet injects an analgesic to the palmar digital nerve, and that numbs the back half of the foot. And then they wait until that is sufficiently numbed, and they ask the horse to move again. And if that lameness is resolved, typically they look for at least a 75% improvement in lameness. Then they say that that horse has heel pain, because when the heel is numb and the horse can't feel that area, if the horse is more comfortable, then the pain should be coming from that area. The vet would then typically take radiographs, and if those radiographs show bone damage, like we said in the first few slides, they would typically diagnose that as navicular disease. And if they take radiographs and they can't see anything remarkable, then they might say that the horse has navicular syndrome. Some people now are fortunate enough to be able to have access to MRI or even a CT scan, and those have been able to show a lot more information. An MRI can show soft tissue where a radiograph cannot. So you can see the collateral ligaments of the navicular bone, the impar ligament, the deep digital flexor tendon, all those other structures that could be affected, the navicular bursa, and that can actually help to parse out where that pain might be coming from. Of course, an MRI is not feasible for everyone. They can be quite expensive. So a lot of times, if we forego that, we're kind of guessing at what structure is definitely affected in this issue. So again, we kind of addressed this, but what are some structures in the back half of the foot that might be causing pain? We mentioned the navicular bone itself, the digital cushion, that's a big fatty section underneath those heel bulbs. If you take your fingers and you squish the frog and in between the heel bulbs and you're able to palpate that area, that's where your digital cushion sits. The impar ligament and collateral ligaments are ligaments attached to the navicular bone that can actually become damaged. The deep digital flexor tendon runs up the back half or the back of the leg, and that is typically involved when there's any kind of navicular bone damage. The frog can obviously be involved in heel pain, as it's part of the back half of the foot, the heel bulbs and the hoof capsule. So any of these things on a horse can lead to pain and lameness, and they can lead to a diagnosis of navicular, whether the bone is causing pain or not. So separating out all the different ways that these structures can be causing pain and how to approach it can help us to parse out whether this horses actually have pain from their navicular bone or from just another structure that can be rehabbed. So we kind of just mentioned this, but you know, there's a whole bunch of structures that can be causing pain, and I want to be really careful not to label a horse as having a degenerative disease and just focusing on managing pain, if we can instead address the actual cause of the pain and get that rehabbed. So I'm sort of equating it to an athlete with an injury or an issue that needs time to correct. So if you think of, you know, an athlete that injures their knee, if we say that injury just needs some time to heal and then you need to strengthen, then that's, you know, a more comprehensive way to approach that injury, as opposed to just saying, okay, well, this athlete has an injury, we're going to give them some pain meds and give them a knee brace and let them do whatever they want. that's likely not going to get that knee stronger. So I want to focus on, can we get these structures stronger and heal them and get them back to a point where this horse can be an athlete again, instead of just managing them and letting things deteriorate. So again, a navicular diagnosis doesn't necessarily mean that the horse has issues with the navicular bone. Doesn't necessarily mean that it's a degenerative disease. Studies actually show that that nerve block to the back half of the foot can actually numb more than just the heel. So we can actually have the coffin joint or the DIP joint numbed as well. And that involves a lot more of the foot. So we don't actually know if it's the nerve block is just addressing the navicular area. So we want to make sure we're looking at the whole horse's health and hoof to make sure that we're rehabbing what might be causing pain. But also, you know, our goal is a sound horse. Our goal isn't necessarily to have perfect radiographs or to have, you know, a bone that remineralizes and looks whole again. We want a sound horse. If you take a radiograph of me or give me an MRI, I probably have a whole bunch of jewelry all over me from working with horses my whole life, but I feel pretty good and I can do pretty much anything I want. So our goal is to get our horses to a point where they're strong enough where other structures might be compensating for any other issues that could have happened in the past.
Well, and Alicia, this brings up the point that, you know, when we're looking for navicular, we've already screwed the population. So what we don't know is what is the population that actually shows changes that aren't showing pain, right? It's just like people, the population is so skewed because they're looking at the people with pain, but I've known people with wicked arthritis and they don't have any pain, so nobody looks at them. And then, you know, so it is a skewed population.
Right. Yeah, actually, Dr. David Ramey, he has a blog, and one of his articles is one of my favorites. It's called The Persistence of Memory. It's like the tagline is, what do you mean I don't have to give isoxaprine to my navicular horse? And he said that there was a study done, I don't know exactly when it was, maybe the 90s, so it was a while ago, but they took a bunch of radiographs of navicular bones and they threw them on a table in front of a bunch of veterinarians. And they said, can you tell us which horse would be lame based on these radiographs? And the veterinarians were wrong in almost like every case. So they found that horses that were perfectly sound and comfortable and in, you know, working careers, they had all kinds of wonky looking navicular bones that had lollipops or invaginations or degeneration or odd shapes. And they were perfectly happy horses. So to just blame pain on the appearance of a navicular bone, I think can be an oversight in what actually might be going on. So I never want to write off a horse just based on what their bone looks like. All right, so how can we rule out other causes of pain? This is going to be the bulk of this webinar. Is I want to slowly kind of do an elimination-style rehab on my navicular cases. I want to take out as many things that could be causing pain in that horse's hoof and see what we get before I just say, okay, this horse is, you know, has chronic issues that are going to always be uncomfortable. So we're going to talk through some of those now. All right, so the first one, I always start here, are diet issues. So it might sound crazy. I'm sure that some of you are going to think, you know, you're kind of going to roll your eyes that, oh, my navicular horse just has a diet issue. But a huge portion of the horses that I see with hoof issues become exponentially more comfortable once we address any dietary triggers for their hoof problems. So I know I've quoted it a bunch of times. If you've been on any other webinars with me, Dr. Thomas Teskey has a great quote that the healthiest hooves are attached to the healthiest animals. And I have found that to absolutely be true.
Alicia, this makes so much sense because inflammation, like I've been talking a lot to Dr. Rachel Bellini and we're constantly talking about inflammation. And so if your diet is creating inflammation, isn't that going to cause foot pain? Just like, you know, just like I ate the wrong thing the other night and I woke up and I was like, oh, my eyes are all puffy.
Yeah.
So,
yeah, I know that when I eat too much sugar, I can feel it in my joints. I get headaches. And even if I did have like an old chronic injury, I actually tore a ligament in my wrist a few years ago. And when I eat a bunch of junk, I can feel it in that wrist. I don't know if it's just like body-wide inflammation kind of stirs up some past injuries that I've had, but I think that that could be true for horses too. I can't say that is because I don't have, studies done on that. But if you think about a laminitic case, 90% of laminitis is metabolic or endocrinopathic. And so diet plays a huge role in the inflammation of the lamina in that hoof capsule. So if what they're eating can inflame the lamina in their hoof capsule in a metabolic horse, I don't doubt that it can do it in most horses if given, the wrong or something that horse is sensitive to. So again, I found it to be true that I would say 70% of the navicular cases I come to, once they get their diet back on track, those horses are significantly more comfortable, at least a lameness grade improved. So when the horse is getting all the nutrients it needs, their lamina connection, their wall quality, their sole depth, their frog health, they can all grow and function at its healthiest. And while something like the quality of the wall might not seem that important when it comes to a navicular case, a horse that has poor hoof quality is likely going to have hoof discomfort. So we want to give them the strongest hoof possible. We want to build a strong hoof for them so that if there is some weakness inside that capsule, the hoof itself can help to compensate for it. So again, how can a horse that just have diet issues be misdiagnosed? I mean, use that kind of loosely, but be misdiagnosed as having navicular? Well, if this horse has a palmar digital nerve block, so the back half of the foot is numbed, or an abaxial sesamoid, which is usually the next block they do that numbs the whole foot, we found that, you're numbing more than just the heel. So this horse could actually have inflammation around the whole hoof capsule. So, maybe there is a little lamina inflammation there from diet. And then they do these nerve blocks and the horse becomes sound. And they're like, oh, well, we numbed the heel and the horse is sound, it must have navicular, when really maybe that nerve block was actually numbing more of the foot, and it's just that there's some more lamina inflammation or something else going on. So like we mentioned in the last slide, improper diet or improper mineral balancing can lead to a weak lamina connection, and that can affect a lot of things. A weak connection can lead to excess leverage, like having a hangnail chronically. It can lead to, laminitis, obviously at its worst, or rotation. It can actually lead to thin soles because the lamina is not properly suspending the coffin bone within the hoof capsule. It can lead to some, soreness over various surfaces. And if that horse is sore, then they're going to change the way they move. I mean, if my foot hurts, I'm going to change how I move biomechanically to compensate for that pain. So if a horse is moving or differently due to pain, then that can lead to a repetitive strain type injury in their hoof or up their leg. So again, like I said, the majority of cases that I see improve significantly just simply with a diet change. So if they're able to get that diet change, grow that healthier lamina connection, grow a better frog and sole and wall, then they're able to feel more comfortable in their feet, move more, extend more. Then movement becomes almost like a physical therapy to all their hoof structures, and they're able to strengthen. And then you can kind of stop that cycle of degeneration and atrophy that's happening due to that change in movement. And instead, like going to the gym every day for a person, every time that horse is walking around, it's instead building those structures, kind of like us building our muscles going to the gym.
Alicia, has anybody done a study to look at the percentage of navicular in horses in stalls versus horses turned out?
Not that I know of, but I will say that the navicular cases that I work on, the ones that do the best are the ones that get the most movement. I also think that horses that move the most are the ones that have the healthiest feet and the ones that have the healthiest brains and mental, health. They're just, I think that horses are made to move, and it's good for them all over their body and emotionally and mentally. So, but it would be interesting to get a study like that. So what is a diet that's good for a navicular case? I think it's a diet that's good for any horse. You know, this could be a whole webinar in itself. And actually, my first webinar I did with Wendy was called The Owner's Role in Hoof Rehabilitation. And we spent about 45 minutes on diet. So if you want a super in-depth discussion on diet, definitely go back and watch that. It's on Wendy's YouTube channel. But just the basics.
And you have a playlist, so people can find all your webinars just by going to your playlist. Just want to put your plug in there.
Awesome. Yeah. And I'll kind of toss in some references to the other webinars I've done with you. So yeah, you can check out those too. But so this one, we've talked about this in that first webinar, but kind of the basic gist is that we want to feed a horse primarily from forage. So we want their calories to be primarily coming from hay or other forages. If, you know, obviously, well, actually not obviously, if we're testing hay, we can actually see that 97 to 99% of hay samples are deficient in copper and zinc, and have some imbalance of minerals. So I do like to see minerals added into their daily diet, but I don't like to do that with grain in 90% of cases. So I like to use a forage-based carrier. This can be something like a little bit of Timothy pellets or unmolasses to beet pulp or Timothy balance cubes or something similar, and adding in the minerals that they need to compensate for what their hay is lacking. The best thing to do in my experience is to get a hay test. It's not crazy expensive. I usually do test number 601 from Equine. It's about $30. And you can check to see what's in your hay. It'll tell you the protein levels, how many calories they're getting per pound, what the moisture level is, the major and minor minerals, what the sugar and starch is, and all of those things can affect the quality of hoof that your horse is growing. But also it's just, you know, if you're buying a bunch of things or feeding your horse a bunch of grain and it's not what your hay needs, then you're going to just be throwing stuff down the drain, basically throwing your money down the drain. So again, you know, a huge portion of navicular cases I come to actually come up sound just from targeting their diet to something that they need to get the nutrients that they actually need so that they're growing that healthier foot. Let's see, I think I have some pictures here. Yeah. So this is a horse. All the pictures in here, I think all the pictures in here are actually cases that I work on. So this is a horse that was on not a bad grain, but he was on a good amount of grain per day. He wasn't on any vitamin or mineral supplements. And this was, you can tell, a huge event line right here and this tighter capsule above it. This was after about 3 to 4 months on a forage-based diet with extra copper and zinc and targeted minerals. And the owner wasn't able to test their hay, but they just did like a best guess based on their region. And they still got this much healthier hoof wall growing down. And you can see below it, we have this flared wall with event lines that's just, you know, showing chronic inflammation. Let's see. Sorry, we're watching a dog that's a little bit stressed. All right, so here's some more diet changes before and after. I will say these horses were not diagnosed with navicular, the ones in these before and after pictures, but they do show the changes that can grow out from just simply a diet change. So on the right here, we have a horse that had chronic white line disease, really poor wall quality, always chipping, these chronic event lines. And this was just a year on a new diet where the wall was able to grow down from the coronary band and grow out all that junk. And on the left here was actually, this is a good friend of mine's horse. He was a founder metabolic case. And again, just from changing his diet, he was able to grow out all this rotation. And he's actually comfortable barefoot over all surfaces now, just from changing his diet. Let's see. So again, you know, there's more than one thing that can go wrong in a navicular case. So the next topic that I think is really important are frog issues. So knowing that a horse with a weak external hoof will likely compensate in their movement, that can lead to, you know, an atrophy in their heel structures. It shouldn't be too much of a stretch to realize that if a horse has frog issues, they're not going to want to weight the back half of their foot properly either. So this, you can probably see, this is a very weak frog. Actually, it's on the hoof that was on the left photo in the before and after in the last slide. Same hoof, same horse. So this, you can see these heel bulbs are pinched. There's a big central sulcus split right there that I have some hoof stuff by Red Horse shoved in there. So we want to get that frog stronger to make sure that that horse has something to land on that's comfortable. So a lot of what I'm going to say in this slide about it being misdiagnosed, this is going to be a repeat for those of you that watched my frog webinar with Wendy, called Recognizing.
I can never hear it often enough. Okay.
I mean, I think that's true. The amount of times I repeat, treating thrush and things to clients, I sound like a broken record, but it's so important. So at the most basic level, I know that we just kind of mentioned this, a horse's frog is part of their shock absorbing structures in the back half of their foot. So a healthy hoof moving with purpose should land primarily heel first if it's on a flat level surface. This allows the horse to use their frog and that digital cushion that's underneath their frog in between their heel bulbs as part of the landing process, and it helps to distribute shock and the ground reaction forces for that horse so that those forces are evenly distributed up their limb and not causing excess torque or strain or issues with those joints. So if a horse has a healthy frog, then they can do this really well. And on the other hand, a horse that has a painful frog, they might shorten their stride. They don't want to land on that frog because it hurts when they land on it. So they'll maybe land toe first, or they just, they don't fully extend. They want to avoid that pain. And so if they have even just a weak, skinny, underworked, atrophied frog, it's not going to be a very good shock absorber, which can lead to a lot more problems than just having a thrushy frog, because if that's their shock absorber for those ground reaction forces and it's not able to do its job, then it's going to affect how they're distributing those forces up the limb. So I know this is kind of a soapbox of mine, but it's crazy to me just how many horses I see that are diagnosed as navicular, and I show up to them and I see this like honking huge central sulcus split that I stick a hoof pick in, and that horse yanks their foot away like I just stabbed them. And then we get that thrush treated, and that horse now can move beautifully over all terrain. And, before that was treated, the horse was diagnosed as having a degenerative navicular disease. So I think it's really important to make sure that we rule out any issues with the frog before we just write a horse off as having a degenerative problem.
Alicia, given that, horses develop habits like people, if you're if you've got a bad case of thrush, as you're talking about, and your heel starts to hurt, you start to walk different. But even if you treat it, is there an element of habitual movement patterns that come in, and then the horse doesn't regain movement? So now it just kind of keeps going, it exacerbates?
I do think that there are times when we have to kind of unravel their learned compensations. And actually, I do use a lot of Surefoot pads for those horses because I think they're just kind of relearning where their body is feeling certain issues. But I find that if I put a little bit of pea gravel, like 4 to 6 inches deep of pea gravel around their water trough, and they're able to sort of sink in and feel the pea gravel around their frog, around different areas of their hoof, and realize oh, hey, it's not painful anymore. I find that over time, they're willing to move better, willing to extend. They do sort of have to relearn that though.
Yeah, and not everybody has access to pea gravel or control over their I totally get it, but not everybody has that access.
Right. Yeah. And I do in those cases often as well, I'll do really gentle forward stretches of their front legs, where after I do a little walk warm up, so their muscles are warmed up, I'll hold their fetlock really gently, and I'll ask them to pull their foot forward. And I just do it within their own comfortable range of motion and see how much they're willing to extend that. I don't force it. I don't want to injure anything. But usually over time, the more you ask them to do that, the more they're willing to extend until they're eventually willing to really stretch out. And I feel like that has helped loosen up a lot of shoulders and pull, wither areas that are all tight due to them just having such a short stride for so long.
Yeah, and that sounds like that's where like the T-touch stuff and the leg exercises that Linda Tillington-Jones created there would be really helpful as well.
Yeah, and I know that you've done some webinars on that too, right? Yes.
I have done webinars on almost everything, not everything, but
Right, yeah. So again, I kind of skipped over it on the last slide, but how are these horses getting misdiagnosed as having navicular? Well, let's say a horse is lame because they have such deep thrush that they're short strided, or even head bobbing from having such painful thrush in one foot. And a vet comes out and maybe I'm not blaming vets at all, but maybe they're not necessarily paying attention to the frog because they're focused on the lameness, they're focused on taking a radiograph, and the horse nerve blocks to the back half of the foot because the frog is painful. They take a radiograph, and if they find navicular bone damage, then that horse will automatically be labeled as having navicular disease, whether that is what's causing the pain or not. And so this is where, again, like I said, it gets to be a little bit of a soapbox of mine, but I find that not many people recognize what a healthy frog looks like and what we should be striving for. So that's why I did a whole webinar on it. So how do we get a healthy frog? Well, proper diet is a huge part of it because we want to be providing that frog with the nutrients it needs to get healthy tissue. And if a horse is not getting the nutrients it needs, then they're not able to fight off the microbes that their hoof meets every single day in its normal turnout environment. A horse walks over thousands of microbes, and some are good, some are bad. There's all different kinds. And if a horse's immune system is compromised because they're just not getting their basic needs met in terms of vitamins and minerals and nutrients, then their frog's not going to fight off that bacterial or fungal infections that they're coming across. So the other thing, diet can take a while to take effect. You're going to have to kind of meet those deficiencies and top up that horse and get them healthier. So in the meantime, you're going to have to do topical treatments in the frog. And those, my favorite right now, are Red Horse products. I also recently have been using a lot. Christina Brogdon makes this product called Toe Jam, and I love it. I've been putting it under all my glue-ons, and I've just been super happy with what the feet look like when I take those glue-ons off. So that's another really good product. But just make sure that it's something that is non-caustic. I tend to avoid things that are purple or that stain everything it touches. A lot of countries actually have banned substances like gentian violet that are purple because they're just caustic, and they can actually, some of these substances can harm healthy tissue, which is the opposite of what we're trying to do. So treat it with something, again, like I have that webinar that talks about all these different kinds of topicals that you can use that's not going to harm healthy tissue. But really, one of the best things you can do is get that horse proper movement. Movement is going to be stimulating that frog enough where ideally it's stimulating that frog to grow healthy material. And you want it moving over varied terrain. So again, that webinar is called Recognizing a Healthy Frog. If you're worried at all that there might be some thrush issues going on, it would be worth to go back and check that one out. So these are all before and afters. These are actually from that webinar that I did on the frog. So this hoof in the top right corner is the same hoof from two previous slides. So it's the same foundered foot, but you can see in that left photo how tight these heel bulbs are and how deep this central sulcus split goes. Well, it's hard to see from this angle, but this, I could fit my entire hoof pick in there and feel like I wasn't getting to the bottom of this split. On this right photo, you can see, I think there's quite a bit of time between these two photos because I just wasn't good at taking updated photos. I think this was a year or two apart. But here you can see the heel bulbs are much wider apart. They've opened up quite a bit. And this central sulcus is just a thumbprint. And this is after diet change and some thrush treatment. And then this photo here on the bottom left is actually only 5 weeks apart. So all I did was told the owner to treat, we used Red Horse Artemud, And she just smeared that all over the frog. And 5 weeks later, I came back and it was so much better. You can
I
tell.
love Artemud.
Yeah, it's so great. I can often tell how much an owner has used their thrush treatment by how the frog looks when I come back. So you can't really lie to us about how much you're using it, because it is really effective. And then this bottom right photo, you can actually see in this picture here that there's some red horse hoof stuff in this central sulcus split. This is kind of a dark photo. It was an owner photograph, so I didn't take a good picture when I met this horse. But this is the same hoof almost a year later, and you can just see this, the whole heel area has opened up quite a bit, and that frog opened up a lot. All right, so the next thing I want to talk about are trim issues. And I'm going to be the first one to say that there is not a specific trim for navicular diagnosis. There is no specific trim. I'm not going to give you a prescription trim for navicular diagnosis. I apologize. I don't have a magic trim for it. Anyone who knows me knows that I hate giving trim advice from pictures or giving trim advice online, because most of the time I make my trim decisions as I watch the horse walk up. I'm watching how they move. I'm watching their biomechanics. When I pick up a foot, I look at the wear patterns on the bottom of the foot. I look at the collateral groove depth, how deep the sole looks. I look at the health of the frog. I'll often feel how the horse is shifting their weight when I pick up a foot, or how they're asking me to get their foot back when I'm trimming it. And that all affects how I trim. So I can't even tell you when I come to a horse the trim I'm going to do on it. It almost can become a little bit second nature or more intuitive once you get to know horses too, and based on what they like and the environment they live in. So I really can't tell you the trim to do for your horse, and I'm not going to be the one to tell you to just, you know, keep hacking toes off and get them back. And I know that might be a controversial thing to say, but I really feel that the best trim you can give a horse is a trim that leaves that horse moving the same or better than before you saw it. So I know that might be annoying that I can't give you any kind of special prescription.
But Alicia, it's the same thing as like when somebody asks me rider advice. If I can't see the rider move, how can I tell them, right? Everybody's an individual. And I think what you're trying to say is each horse is an individual, and without actually standing there and seeing what that horse does, you cannot say how he's going to want to be trimmed, because it's not just trimming by numbers, it's trimming by the brain in that horse and what he thinks of it as you're working.
Right. And you will get feedback after a trim, and the owners are great for giving feedback. So I always try to ask my owners, how did they feel after I trimmed them? Was there any discomfort, you know, at the beginning of a cycle, towards the end of a cycle? And all of that helps influence what I do in the next trim. So, one rule I have, we were just talking about this, but one rule I have is that the right trim is the one that leads to a more comfortable horse. So proper biomechanics and movement, like we talked about, they're going to act like physical therapy for these cases. So if we give them a trim that makes them sore, and that horse ends up having compensatory movement because of it, we're going to lead to more knock-on problems and repetitive strain type injuries, because we're making that horse compensate because of what we did. So my goal is I want this horse moving as comfortably as possible after I see them. And obviously trimming is a subtractive process. So a lot of times taking more material away can make them more sore. So we need to be I like to be really careful about the decisions I make on what to remove. So as much as I say that I don't focus on having a perfect angle or just on appearances, I do like to actually, a lot of times with my navicular cases, I use my Surefoot half physio pad, and I'll swap between the orange firm side and the soft gray side. And I watch the horse and how they stand on that pad. So I'll pick up the foot, stick the pad on the ground, let them stand on it, and I'll see how are they leaning, how are they shifting their weight, are they digging their toe more into the pad, are they kind of leaning back, are they shifting to one side more than the other, and I'll kind of let them think about it for a little bit especially if I'm coming to a really difficult navicular case that has not responded well to other treatments. I want to see what that horse prefers. And a lot of times we don't ask horses what they prefer. And I find that even if it seems like it's something that's going to make the hoof imbalanced, that even if it's just for a cycle or two, it's like they just needed that little, weird change just to allow them to adjust what they need for that time. And I actually really love the Surefoot pads for that. So thank you for making them.
Well, and one of the things there, when you're typically working on a horse, you're on a hard surface. You're either on a hard mat or concrete or hard dirt. And, I now that I've made these squishy blocks, which you saw when we were there last year, you get to see how the horse wants to load the foot when the surface gives. And when you think about turnout, most surfaces the horses are turned out on, or, even in their stalls, is going to give to their weight. So, it's not the only piece of information. It's another piece of information to see, well, if you have a surface that's going to give to your weight, where are you putting your weight?
Yeah.
Right. And that's what how you're using, that's cool that you're using the half physio pad to ask that question. Is like, if the surface gives, like it would if you were outside, where do you want your weight? And so that's awesome.
Yeah, and something that we have to remember, especially in navicular cases, is that a lot of these cases have a past injury or some kind of calcification or some kind of demineralization or some kind of ligament issue. And while it might not be a picture perfect radiograph or a picture perfect angle, if we're allowing allowing them to choose their comfort based on that past injury, then we're giving them what their body can handle at that time and kind of making changes based on that. Or at least that's what I've seen in my experience. And I know that others have had success doing other things. But that's something that I'd really like to give them the option. So I know that.
But I do like your point. Well, there have been some approaches where the horses are sore afterward. And I can think this was quite a while ago, but, and people thought it was okay, but you can't tell the horse, I'm sorry, I'm going to make you sort of make you better. You can't tell them that.
Yeah.
That doesn't, so the idea of, even if it's not what you're looking for, in the ideal world, is the horse comfortable enough to handle the change that you've just created so that we can move him down the road gradually and get him back to a better place?
Yeah. And I will say with navicular cases that I work on, I see them get better the best with movement. So all of my trim decisions are going to be based on comfortable movement. And I know that there's whole other theories and methodologies where they're saying, okay, well, horses stand around for the majority of the time, so we can focus on, proper angles and a static balance and how to get them to stand properly. But I just see navicular cases improving exponentially faster and rehabbing back to basically no maintenance if we can get them comfortably moving with every trim. So it's sort of a different approach, and it's just what works for me and what I see working faster.
They're designed to move.
Right.
They're designed to move, and we have to get back to the idea of, can we get them moving so that they can, yes.
Yeah.
Okay.
And I know obviously this side does talk about angles, and I do think that there are cases where there's been either neglect or a long history of a trim that's just not balanced well at all. And those angles are so bad that it's putting so much extra strain on soft tissue, where you do need to correct those angles because it's just so much extra pressure on that joint or on the DDFT or on the collateral ligaments. But a good example of the opposite of that is I actually have a navicular mare here right now for rehab at the farm. And she has broken back angles. So, her short pastern bone, her long pastern bone, her short pastern bone, and her coffin bone are all kind of out of alignment. And there's schools of thought that say that like these three bones should be perfectly straight to have the least amount of strain on the DDFT, the tendon, and those ligaments, and on the navicular bone. And so if you look at this mare, you'd say, oh my goodness, she must be like, we need to just like stick a wedge on her and chop off her toe and lower her toe plane and get her heel up. And anytime you put her in cloud boots with a wedge pad, she's significantly more lame. And then anytime, you try to lower her toe, she's less comfortable. And so I stuck her on a Surefoot pad when she first came in, and she immediately sunk her heel into the pad. And she just like, oh, thank God. And she does have calcification of her collateral ligaments and calcification of her deep digital flexor tendon. And for whatever reason, I think that is limiting how much I can change her angles without it being painful for her. And since I've stopped trying to adjust her angles, she is, I mean, 100 times more comfortable. Like, it's crazy to me. I've been sending videos to her owner about how much more comfortable she is, just because I asked her, okay, well, you don't like what's going on here. What would you do if you had the choice?
Right. Awesome.
Yeah. All right. So again, we already talked about this in the last slide, but the trim is very individual to the horse. And again, I tend to focus more on dynamic balance. So their balance and comfort when moving, instead of static balance, which is their balance when standing still. So some good resources. I really love Progressive Hoof Care Practitioners. That is the organization I am certified with. It's progressivehoofcare.org is the website. They are awesome. They have members like Pete Rainey, Ida Hammer, Paige Poss. There's so many others that are just these amazing teachers in the hoof care world. And they don't have any kind of specific trim or specific guru or anything like that. They want to focus on what gets the horse comfortable and what's right for that individual horse in that individual setting. And that's where I think a lot of my ideas come from. And so if you're wondering, okay, well, how do I trim my navicular horse? I would suggest checking them out. It's only $60 a year to join, and you get discounts on webinars, clinics, conferences. You can get one-on-one mentorships. It's a really great organization.
It's a really collaborative group. I've been to that annual meeting, and yeah, it's a group of people that really want to learn, and just, yeah, it's fun. They're fun.
Yeah,
I will say no more.
Yeah. And then the book that had a huge influence on me with my navicular horse was Care and Rehabilitation of the Equine Foot by Pete Rainey. It's a huge textbook. I'm pretty sure it's only available on his website, which is hoofrehab.com. But those are just two. There's so many resources for trimming, but these are two that I found have been the most helpful in my navicular cases. So these are some trim before and afters. And these are not all navicular cases, but these are some examples of trims that were just like not working for the horse. And you can see that for the most part, these the bottom after pictures do show better angles, adjustment that is having a straighter alignment. But overall, I wasn't focusing on alignment with these cases. I was focusing on getting these horses to move more comfortably. And that might lead to straighter alignment, in a lot of cases. All right. So another common issue that I see resolving a navicular diagnosed horse's lameness is getting metabolic issues under control. And it might sound weird, but it's probably not surprising that metabolic issues lead to systemic problems. They lead to inflammation. They lead to hoof issues, which is why metabolic cases can become laminitic, because their metabolic status can so closely be tied to laminate inflammation. So I see horses, I've had a handful of cases, and I'll show you in some of these slides, where the horse was diagnosed as navicular, was just living on NSAIDs, and just said it's going to be degenerative. It's just how they are. And then once they got their blood work pulled and were treated for metabolic issues, the horse went sound. So it's just another thing to rule out. So how can it be misdiagnosed? So again, if a horse has uncontrolled metabolic issues, then they could have laminate inflammation. They could have hoof sensitivity, thinner soles, and hoof pain. And then vet comes out, notices the horse is lame. They become sound when you numb the back half of the foot, because maybe it's numbing more of the foot, and that horse is diagnosed with navicular. And a lot of times these horses don't have a typical metabolic appearance. So they might not be an overweight horse. They might not have the fat pads. They might not have a crusty neck. They might not be they might not be super old. I've had horses as young as 14 or even younger that were diagnosed with Cushing's. So, you don't think of that when you see a younger teen horse or a horse that's 11 years old. You don't automatically jump to having a Cushing's diagnosis. But a lot of these cases are the ones where they don't get treated for their metabolic issues because you just assume they don't have them. So some common symptoms I see if a horse has metabolic issues is, they might have poor wall quality. So these are horses that might always get white line disease. They might always have flaking, shelly walls, chipping walls. They might seem like they're always growing toe if they're just constantly shooting out toe, and every time the farrier comes, they're just taking the toe back, or they have a really stretched toe. A lot of times that can be a symptom of a metabolic problem. And of course, it's just sensitive over different terrain. I see a lot of hoof sensitivity. If it's not a diet issue, I see it as a metabolic issue, just because of that systemic inflammation. So metabolic testing, obviously a hoof care provider can't do that. You as the owner can't do that. So you have to ask your veterinarian about insulin levels and ACTH levels. Those are the two most important ones in my opinion. From January to June, naturally a horse's ACTH, which is the hormone that's involved in a Cushing's diagnosis, it's naturally much lower than the rest of the year. So a horse that is a Cushing's horse might have a normal ACTH level during the springtime, so between January and June. So if you want to really rule out Cushing's during this time of year in the Northern Hemisphere, then I usually say to try to get a TRH stimulation test. That's where they'll take a baseline ACTH blood draw, and then the vet will inject a thyroid stimulating hormone, and they'll wait, I don't know, 10 to 20 minutes and let that hormone do its job, and then pull another ACTH blood draw to see how ACTH respond, or how the pituitary gland responded to that thyroid stimulating hormone. And that can tell you how that pituitary gland is functioning. During the fall, there is a seasonal rise of ACTH, of that hormone. It's normal. All horses experience that in the Northern Hemisphere in the fall. This is triggering them to grow a winter coat. It's natural. But horses that have Cushing's, that seasonal rise will go way out of whack. So if you pull blood during the fall, then you can just do a baseline, and typically that will catch that'll catch a Cushing's case without having to do that TRH stimulation test. Two really good resources for blood work. ECIR is the Equine Cushing's and Insulin Resistance Group. They are a free volunteer group online. It's ecirhorse.org. They are fantastic, and they want to help any single owner of a metabolic horse to prevent laminitis. They're so helpful. They have really good metabolic testing protocols. And then the Tufts Endocrinology Group, they have a PDF online. They have updated their protocols in the last few years, and they can help, if your vet sees that, they can know which tubes to use. I mean, your vet should know how to do this, but if there's any question, they have a really good outline of how to pull the blood, how to store it, how to send it in, which tests to get, and things like that. All right. So this is the case that I mentioned when we first started talking about metabolic issues. So this was a 20-year-old quarter horse. He had a very carefully managed diet. I've been trimming him for 2 years at this point when we got the top radiograph taken. He had the same cycle, same kind of trim approach. We hadn't really found something to get him comfortable. He was sore over all surfaces. He was lame, like head bobbing lame. Couldn't be ridden for any amount of consistency. He was intermittently off, but he wasn't laminitic. He wasn't like, so lame that anyone would have thought that he had, a lamina involvement in his lameness. But he was tested for, the owner asked the vet if she could test for Cushing's, and he came back like wildly positive. And he was, there were no other signs. He didn't have any other symptoms. He wasn't, he was in pretty good condition. He looked okay. His feet weren't like wildly unhealthy, and he just had some lameness that was intermittent. And once he got on Pergolide and could be treated properly, and his ACTH levels got under control, his hoof just grew in so much healthier. And I wish I could say like, oh, it was a magic trim and like we figured out the trim that worked great for him. But no, it was just medication. And he is now sound. He's in full work. He's ridden, I don't know, 5 days a week. This was in, oh gosh, 2020 or maybe very early 2021. Yeah, so 2020 was this radiograph on the top. This bottom one was actually in January 2021. So like 6 months later. And he had like doubled his sole depth and just was so much more comfortable. And actually, when he first came up lame, there was some question whether there was some calcification on P2 right here and whether that was some ring bone involvement and that's why he was lame. But he hasn't had issue since the pergolide treatment. So the next thing we want to rule out, and I know that we've talked about this already in this webinar, is movement issues. So many navicular diagnoses are more like a repetitive strain type injury. So it's like these horses that are moving toe first, landing toe first because of a variety of issues. It could be frog pain. It could be, you know, inflammation in the hoof from any of the other things we talked about today, like diet or metabolic issues, or a trim that's making them sore. And they're just shortening their stride, they're sore, and they're landing toe first. And over time, I know that Wendy knows this, Dr. James Rooney has found that over time that this can lead to soft tissue damage in the back half of the foot. So the deep digital flexor tendon or the collateral ligaments. And then that soft tissue damage causes chronic inflammation and can cause the navicular bone to remodel. And that's why we're getting to see these radiographs that have bone damage. And, you know, every single case that Dr. Rooney has found was a result of soft tissue damage and not just the bone in isolation. So
we can't rule out saddle, fit, and rider organization.
Yeah, so basically anything that can affect movement is going to, you know, it can cause problems. And so if we're coming to these cases and treating them like they're a repetitive strain type injury that needs physical therapy, then we can often get these cases sound without having to, you know, resort to just treating them as if they have a degenerative disease. So actually one thing I want to mention that I almost forgot, I just glanced at my notes. So Rockley Farm Navicular Rehab is where I got just my passion for rehabbing my own horse. They're in the UK. They're so fantastic. They've been rehabbing navicular cases for 2 decades. They have an 85% success rate of getting horses back to the same level of competition or higher, despite what their MRIs or radiographs show. So there are horses that were told to be euthanized based on their radiographs, or told to be, you know, retired and had a 5% chance of returning to any kind of career, that then went back to fox hunting, eventing, show jumping, dressage after addressing their movement issues. So their big focus is on movement, which is also why my big focus is on movement. I flew there in 2015 and just saw like they just have an incredible success rate, and their horses are some of the most comfortable horses I've seen. And these are horses that have some terrible radiographs and MRIs for navicular. So I truly believe that getting these horses moving more comfortably is so incredibly helpful in these cases. So how is this misdiagnosed? Well, I wouldn't say that a horse with improper movement is necessarily misdiagnosed as having navicular, because horses that have heel pain will change how they move. If they have heel pain, they don't want to usually land on their heel, and we want them to be in an ideal world landing heel first if they're moving with purpose at a forward walk on a flat level surface. So it's not really a misdiagnosis. It's more of these cases are labeled as degenerative when I don't think that they are. So if we can get them landing and loading more comfortably, then often we can get a sound horse over time through like a physical therapy type rehab, instead of just, you know, tossing some NSAIDs at them or putting them in corrective shoeing. So if I come to a horse that's diagnosed as navicular, the first thing I usually do is take a slow motion video from the front and from the side as they walk past me. And I'm watching to see, are they landing toe first, flat, or heel first? Are they landing harder on one side of their foot than the other? Sorry, bud. Hey, Bo, come here. Sorry about that. We have a hay delivery, so he's very distracted. So, you know, I want to track their movement over time and see, what we're doing to their feet and their diet and their thrush treatment, is that changing how they're moving? Are they moving more comfortably as we do that? So let's see. So here, this image here is a navicular horse that I met in April of last year. He was in his 20s and he had been struggling with navicular pain for quite a while. So I don't think that anybody suspected that he was a rehab case. Most people just thought that he was a management case that was going to have to just, you know, deal with what he had in his hoof as a, you know, chronic degeneration, and just live on NSAIDs to stay comfortable. So the first thing we did, like I said, is we filmed his movement. So in April 2022, so it's a top picture, we filmed his movement. He was landing very toe first on both fronts. And, you know, he had navicular bone damage on his radiographs, and he was, you know, said that that was just going to be how it was for forever. So within a few months, so what is that, April, May, June, July, 3 months of changing his diet. So we did more of a forage-based diet. We gave him better minerals, got him on some omega-3s, treated his frog to get his frogs more comfortable, and using boots and pads for comfort as needed, so that it was promoting more comfortable movement, more heel first landings. Within those 3 months, even without the boots, he was then landing heel first. So you can see in that bottom picture. And then from that point, once they're landing heel first, then it's almost like physical therapy every time they move and land heel first, because that is the best way for the frog and digital cushion to absorb those ground reaction forces from the ground. So that way these structures can distribute the force properly, but also be utilized and strengthened over time. So he's now ridden daily. He's the most comfortable that I've ever seen him, but the owner has been sending me videos of her doing walk, trot, canter, riding all around, enjoying him. He's no longer on equiox, and he's comfortable. He was one who I met and took corrective shoes off him, and now he's barefoot. So obviously there are cases of navicular where there is bone pain and there is soft tissue pain. So what do we do in those cases? So I think that growing a healthier foot, there's no downside to growing a healthier foot on a horse. So how do we grow a healthier foot? Well, diet, thrush treatment, a comfortable trim, using boots and pads as needed. If you're able to, using conformable surfaces like pea gravel, and getting that proper movement is going to allow the best circulation and perfusion through the hoof capsule to get the horse the healthiest foot possible, and getting them rehabbing those internal structures, strengthening the digital cushion, strengthening the frog. And ideally, that horse is then able to almost forget that they have bone damage if that surrounding tissue can compensate for it. So I've seen cases where the bone is trash, like it has, you know, a huge cysts or flexor cortex damage where that outer layer of bone is like totally demineralized, or has calcifications. My own horse has enthesiophytes or bone spurs off the sides of his navicular bone. And these cases where you see the bone, you're like, there's no way this horse can be comfortable. But if you get the rest of their foot and those internal structures strong and healthy, then it's almost like they don't notice they have bone pain because those structures are compensating for it. So again, like we mentioned, Rockley Farm is a great example of this. And you can go on their blog. They have 2 decades of case studies up there. Their Vimeo has awesome videos of slow motion videos of horses that have come in for rehab. And they've just been an inspiration. They've helped, you know, hundreds of horses actually at their property, but through their work, they've inspired thousands of others across the world. So they do a really great job of getting these horses with confirmed bone damage and confirmed soft tissue damage back to work. I mentioned this briefly earlier, but I wanted to say it again because it's important to know, or important way to kind of pinpoint if your horse might have soft tissue pain versus some other cause of pain. So if your horse is more comfortable on a hard surface, like you walk them over a driveway or a barn aisle or a really firm dirt road, and they seem like they barely have any head bob, or they're not head bobbing at all, they look like they're almost sound, you can maybe they even trot sound on that surface, and then you put them in a sand arena or a deeper footed surface, and all of a sudden it seems like they're head bobbing even at the walk, or they can't trot sound anymore. Most often those cases actually are soft tissue issues, because the soft tissue it's much harder on soft tissue when there's deeper footing, because the soft tissue has to stabilize between those joints. Like ligaments will be attaching two bones, and the soft tissue can't handle a deeper surface, especially if it's damaged. So that's one way to kind of tell if your horse is lame and you want to see quickly, okay, is my horse better on a soft surface or a hard surface? And you notice they seem more comfortable on a hard surface, you can assume that there's some soft tissue involvement. If a horse seems more comfortable in a soft surface, which a lot of horses are, it's like they get really ouchy, or like they're walking over eggshells when the surface is firm. And then once they get to a sand arena, it's like, oh, okay, I'm so much more comfortable. Those horses might have thin soles, or they might have arthritis, or they could have laminitis. So that's an easier way to kind of differentiate what the pain might be. So I just have some examples of navicular cases. So this one is a warm blood. He's so sweet. I met him in his 20s, and he had been dealing with navicular for as long as the owner had known. And within, I think now I've worked on him for 3 years, but pretty soon with just more targeted nutrition, he still does have some event lines. Actually, this right photo was taken before he got his Cushing's diagnosis. So he was diagnosed with PPID and started on Pergolide this year, or 2022, and has jumped up to that next level of comfort. But even just within a few months of a good diet and using boots and pads and doing a hand walking plan to try to get his heel stronger, he was so much more comfortable, and she was back to doing walk, trot, canter, and little jumps with him in his 20s. So this horse is a teenage quarter horse. And when I met him, he was pretty high-low. So these two pictures are from the same day. I was silly and didn't take a picture with his shoe on the right front, but I took a picture with his shoe on the left front. And he's low on his right front, high on his left front. And within the last 2 years, the owner has done so many things. She's changed his diet, treated Thrush, done tons of blood work, done body work, stretches, bringing him back to work in a sequential plan. And now he's much less high-low, but he's also sound. And he's off Equiox too. So he's another one who was a navicular case, diagnosed, and now he's off Equiox. And you can see in these heel pictures how much his heel bulbs and his heel bulbs and frog have developed. I actually just published a podcast episode today about the digital cushion, and obviously we can't say for sure if the digital cushion actually develops or changes, but there's definitely an increase in mass in the back half of this foot. This is actually the horse that was from the radiograph pictures where he doubled his sole depth. This is that same horse. So when I met him, he had a pretty deep, actually this was a little bit after I met him, but he had a pretty deep central sulcus split, and the owner treated it. And this January 2021 was when we had those radiographs taken where he had doubled his sole depth on that Pergolide, but he also had just a much better frog, much healthier foot in general. And he's also in his 20s, so doesn't mean that just because they're old, you can't rehab them. And this one was that same horse from the movement section. So again, just a few months to get him landing more comfortably. But these left photos here were when I pulled his corrective shoes. He was in wedge pads. I believe on both fronts, but I have to look at pictures to confirm. And he had just like a honkin' shoe package on. And these, you know, these after photos are not ideal. He still has some thrush in these, and he's still growing out some poor wall connection. This isn't a full hoof capsule between these two photos, but he is so much more comfortable, and his foot has developed even since these pictures. So this gelding is another quarter horse. He, again, in his teens, I actually met him. His primary issue, I think, was a fetlock injury and not necessarily the navicular diagnosis. But even just a few months on a better diet in a shorter trim cycle, he had a much healthier foot and was so much more comfortable. And I still trim this horse today. Actually, all these horses, I still trim them. So if you're looking for some resources, the past webinars with Wendy, basically all of them talk about navicular. The Facebook group I started in 2015 after visiting Rockley Farm. It's called Barefoot Rehab for Navicular. But even if you don't have a barefoot horse, I would suggest joining the group. There's so many success cases. You don't have to have a barefoot horse as a prerequisite, but it will talk you through a lot of these things that we talked about in terms of diet and thrush treatment and watching for proper movement. Rockley Farm, like we mentioned, is a really good resource to look at their blog with Nick Barker. Pete Ramey is a great resource. He has articles online. Dr. Bowker, Robert Bowker, I know he also has webinars with Wendy talking about navicular, talking about heel, just heel development, talking about trim. He's a fantastic navicular resource. I do have the Humble Hoof Rehab Guide, which is a journal. I know that Wendy has some copies too. And I do have a book that I am like 90% done with. We're just changing some of the illustrations in it. With Navicular Disease, and it's basically a very in-depth look at what we talked about here. You know, how do I change the diet? How do I, you know, what can I do to get better movement? What resources are there for body work? Those kind of things. And then, you know, if you're near me in New England, I do take navicular cases at my farm so they can get the rehab here that I always wanted for my
Where
work.
is your farm? Somebody asked, where is your farm located?
Massachusetts. So we're in Amesbury, Massachusetts, or right on the border of New Hampshire on the seacoast. So I'm hoping once the weather is better to do an open house. Just right now we have 6 inches on the ground. Yeah. And you can always feel free to email me at thehumblehoof@gmail.com. I will do my best to get back in a timely manner, but it might take a few days, but I'm always happy to answer questions.
Awesome. So yeah, that was one question, was where are you located? And we've got that. Someone's asking, when you work on a new horse, do you also discuss with the horse, I think with the owner, what the horse is eating to see if there's a problem there? Anyway, go ahead.
Yeah. So every case I come to, it's funny because as a professional, you sort of, it's like you have to develop these people skills that I never thought I'd need. You kind of, it's like you're gonna have to be a psychologist and everything. But you learn pretty quickly how to read how open somebody is to discussing the horse's diet. Some people get really defensive about what they're feeding their horse, and so it depends on what I'm noticing from the owner, how soon I can talk to them about diet changes. Sometimes I'll go to them, and the first time I meet them, I'm just addressing one thing. Like, you know, the first time I meet them, I might say, okay, let's take videos of their movement and do a trim that might make them more comfortable in their movement, and we can look at how that works and discuss more things next time. Or I might say, okay, your homework for today is to work on this frog. I don't want to overwhelm them all at once and say, you know, here's a whole book of things that you need to change with their diet. But every single rehab case I come to, I do discuss diet at some point. And a lot of them, that is the first appointment, but some of them it takes, you know, a cycle or two.
And not everybody has control over it, right? So if it's in a bigger barn where they don't have control over, you tell them about the diet and they're going to freak out because they have no control, and then you lose the client. So you know, it's always judging what do they have control over in this moment that you can help them with, so they develop trust with you. Then you can gradually start. But yeah, you can't overwhelm somebody with all the information, everything, you know, like they'll just freak out. It's not fair to anybody.
Yeah, and honestly, sometimes I'll see how healthy we can get the feet before changing the diet. I think the diet is so hugely important and it can make or break rehab cases, and I can't stress that enough. But there are some cases where if the horse is moving enough and there's a lot of good management in other ways, then the diet has some leeway. And so oftentimes we'll get the horse to a certain point. If the owner doesn't want to hear about diet, we'll get the horse to a certain point and I'll say, you know what? I think to really get to the next level of comfort, we're gonna have to change some things in the diet. I really think that copper and zinc is gonna boost them to that next level. Or, after we have a relationship for a while and they know that I'm just, trying to help.
Yep. So this next question is, I wonder how much thoracic outlet syndrome, such that Celeste talks about, could lead to this, but I think I want to flip that question around and say, how much of this is leading to thoracic outlet syndrome?
Yeah. And I think Celeste's work is incredible and she does amazing things for horses. And I think there is a lot of that, like you said, that chicken and egg. Like, are they compensating and moving in a different way because they're sore and then they're developing all these thoracic sling issues? Or is that, what's leading to heel issues? I think there can be instances of both, but I think it's a great complementary therapy.
Right. I think you have to look at it from both directions because, if you have a poor fitting saddle and it's not allowing the horse to use its front end properly, then it's going to land toe fur, et cetera. So
right.
That's one of those, it depends answers, but yes, the bottom line is yes.
Yes.
We have to look at it from all those different aspects. And it's what, I think the key is what can you address right now, because if you go to talk to somebody about a saddle fit issue, that can be just as major a freak out as somebody stuck in a barn where they don't have control over the food. So I think you and I would agree that it's what's within this person's control at this moment that they can do, whether it's Celeste's work or changing the trim or changing the diet, and just gradually progress toward a healthier environment all the way around.
Yeah, absolutely.
Okay, so somebody's saying that changing my horse's diet, grain change has made a substantial change in my horse's feet. Yes. And also a new trimmer. Yes. Okay. So what kind of help, let's see, what kind of help there is to figure out the true cause of the toe landing with my horse? How can I educate myself to understand these biomechanics of movement and see how they look like in real life? Is the wrong movement due to having no muscle, tight muscle? Yeah, I think thoracic problem, and I think we kind of covered it, but go ahead.
Yeah, so I do have a video on YouTube called, oh my gosh, how to assess hoof landings, I think is the actual title. So that is just a 3-minute long video and it shows various hoof landings, how to film, capture them, whether your horse is landing toe first, flat, heel first. In terms of what's causing their toe first landing, that it's hard for anybody to say without doing that elimination-style rehab. So basically I pull out all those possible causes. Like I pull out diet as a possible cause and I remove the frog issues as a possible cause. And if you start to pull away these layers of the onion and then see where your horse becomes sound, then I think it might take extra work, but it's the least expensive and most comprehensive way to tell what might be causing the problem.
Dr. Feldenkrais always said you can't do what you want until you know what you do, right? And which is one of my favorites. So if you don't realize your horse is toe first landing, you can't do anything about it. So, but just doing a video and watching how your horse is landing starts you on the, once you know what's going on, you can start looking for what to do, and it leads you deeper, right? And then all of this makes more sense. So that's awesome that you have a video on how to video. Great. Do you have a website?
Yes, I do. So my website is thehumblehoof.com.
Awesome. All right. Are there, wait, let's see if there's another. Okay, thank you. Any other questions? No, Alicia, I always appreciate having you. So somebody's already ordered your Humble Hoof book. And how they're wondering how it's different from the Navicular Disease book.
So the Humble Hoof Rehab Guide is more of just a journal. So it's kind of a workbook of tracking your own horse's soundness progress. And it has little blurbs of information of kind of like, oh, this is what's important for diet, and this is how to read a hay test. But the Navigating Navicular Disease is more of a narrative of all the different things, kind of like we talked about, all the different things that could be causing navicular pain and how to address each one. So it's much more comprehensive, and it's more of a not, I don't want to say step by step. It tells you more of what to do as opposed to the workbook, which is sort of you kind of on your own in a lot of ways.
And when will it be available?
I'm hoping in March. All the bulk of it is done. We're just tweaking some of the illustrations and images. So I'm hoping to actually just put it up on Amazon so it's easier for people to get.
Oh, I was going to say I'll put it on my website, but.
Oh yeah, I mean, I haven't really figured out yet which avenue to go on, but I know that that Amazon has an option for people to sell their books, and it's a great way to get it across, different countries. So I was going to go that direction.
Yeah, but anyway, we'll talk about that. So is your facility open yet, or is it just are you still getting up and running?
So we do have 3 hoof cases here right now. One is a founder case, one's a navicular case, and one is an arthritis case. That's just kind of chronic lameness due to arthritis. Then I have my own horses that are, knock on wood, not rehab cases. But so I am taking in cases. Right now it's a little bit difficult with the snow, but I have, if you're interested in sending a horse here, you can email me and we can chat about it for time frame and things like that.
Did you get hit with that big storm that's coming across the country right now?
So yesterday we got 6 inches, which really isn't that bad if you think
about it.
Yeah, and I think we're supposed to get more snow this week. I think Tuesday, and I haven't seen the totals yet. I don't really want to.
Yeah. Well, I'm flying through Chicago. Like that's where I'm heading when we get done here. So we'll see how it goes. But anyway, Alicia, thank you so much. I just love listening. Your webinars are so well presented, and I love the examples that you give us, and it's great. So thank you so much for doing this, and for dealing with the fact that I am sitting in an airport. Well,
that's fine. Thank you for dealing with my dog that was barking. So
oh, it's totally fine. All right. So just remember, everybody, you can find this in all the over 300 webinars on the Surefoot Equine YouTube channel. You can just Google it, and you can just go there, and there's playlists. Like this will go in the hoof playlist and Alicia's playlist. So share it with your friends, let everybody know. And of course, Wendy's Winnies for the podcast. So thanks, everybody. Have a fabulous weekend, and we'll see you sometime soon. Bye.
Bye.